Hi, welcome to Body Beautiful. I'm Janelle Marie. This is the show where we talk with local doctors about the latest in cosmetic procedures. Any advice we give you today, remember, consult your own physician first. Today we have our good friend, plastic surgeon, Dr. Joseph Mealy. And Dr. Joseph has been on the air for over 15 years, giving out great advice. We are so happy to have you here. We're going to talk about gynecomastia, tummy tuck, mini tummy tuck, and we're going to end it with an eyelid lift. Thank you so much for being here, Dr. Mealy.
Oh, it's so great to be here.
All right, so let's start with gynecomastia first, because a lot of people don't know what that is. So first off, doctor, tell us, what is gynecomastia?
Literally, it means women's breast.
Okay.
But the problem with it is it's on a man's chest.
Oh, okay.
So usually we're trying to do a breast reduction for men to make them look more masculine and to, help them feel more comfortable both in and out of clothes.
And that's hard for men to do, to come in and say, hey, I think I need a procedure. Is that correct?
It is.
Yeah.
It is. Men, we don't network quite as well as women,
Right.
so we don't talk to as many folks about it. And I've had quite a few patients come in that, until they'd seen the show or gone to the website, didn't really know it was an option to fix it.
Exactly.
And it's so common. It's about 1/3 of men have it even after puberty.
Yeah, it's definitely hard for them to face. So when they go in, let's take a look at picture number one.
Sure.
And tell us what's going on here.
So this is a guy obviously in good shape, very strong, muscles well developed, but he's got this puffiness beneath the nipple and
Right.
the areola. And we call that a puffy nipple, or kind of looks
Okay.
like a scoop of ice cream, sometimes we'll call
Right.
it. So you can see in purple, I've drew a line around the areola. That's the pigmented skin. And then the nipple's a part in the middle. And then afterwards, you can just see the ink at the bottom.
Right.
These pictures are actually on the same day.
Oh,
So
wow.
I did the procedure, took out that extra tissue, closed it up, and there's just an incision that runs along the bottom. And normally what we'll do is just put some steri strips, some tapes over it and around the nipple. And
not
after
bad
a
at
week,
all.
those come off.
Yeah, not bad at all. And
But
of
you can
course
see it's instant gratification. You can see it's
Totally.
better already. Because in this case, it's really localized. It's that one spot, so there's not a lot of swelling.
Let's go to picture number two while I ask, can you just cure gynecomastia with liposuction?
Sometimes, yeah, sometimes we can. The problem is when the tissue underneath the nipple is very glandular, it's very collagenous, it's very strong, and it doesn't come out easily with liposuction. But when
Gotcha.
we call it pseudogynecomastia, which is just fat, it comes out very well.
And picture number two, what are we doing here?
So this one's kind of a combination. There's some pseudogynecomastia and gynecomastia. The
Okay.
chest is a little bigger because there's fat in it, but also there's that fullness behind the nipple again,
Right.
making it puffy and stick out. And that's the part that's annoying in clothes. Unless you're wearing a darker color or a pattern,
Absolutely.
it tends to be pretty obvious that there's fullness there. And the shirt hangs off it, making it look even worse. So in this case, same as the other, we made the incision along the bottom, and I also made a small incision up in the armpit that lets me vacuum out the fat. So I can get the majority of the tissue out with liposuction, and then go back and touch it up, get that stuff in the middle out with a direct excision.
And you don't have to actually cut the areola around that and move it, do you? Or is it?
No, normally it shrinks just from unstuffing it.
Oh, okay.
So sometimes the areola will be large and it's uncomfortably large, but just taking the glandular tissue out from underneath allows that skin to recoil and shrink. If it's very big, then we make an incision all the way around and try and reduce it. But it's tough. Male skin is
Yeah.
very tough, it's strong, it wants to pull everything back out to where it started.
Let's go to picture number three, and I've got an email from Roger from Alamo. Roger says, look, doctor, I like to work out a lot. If I get gynecomastia, because he says in this email that it's very painful if he works out when he has,
Oh, sure.
so he has to get something done, but he says, when can I go back to working out? So let's talk about the third picture and recovery time,
Sure.
please.
So I think, when gynecomastia is developing, when it's getting larger, it does tend to be painful.
Yeah.
So removing it gets rid of that. But in terms of working out, a lot of my patients are working out. Some of them are bodybuilders.
Right.
Bodybuilders, it's really hard to make them stop.
Yes.
So if I can get them to do it for a couple weeks, that's usually enough.
That's good. So
The
that's
first
not too
week
bad.
definitely have to do it because it may cause bleeding, and then we have a problem that we have to clean up.
Right.
But if we're waiting that week, it's not likely to bleed. Next week, it just may swell more, maybe more uncomfortable, and after 2 weeks, usually we're golden.
So get it done, because recovery time's not that bad, especially if
too
you're
bad.
going through a lot of pain.
And this guy, same thing. You can't
Yep.
really see that fullness underneath there because he's got so much fat around
Right.
it. So by removing that fat in the operating room, we'll start to see that there's kind of a hard spot in the middle. And again, we just take care of it. His was a little more challenging because his areola was so small.
Oh yeah, but it's so natural, the look after. I mean, there's no scars. You can't see anything really.
Well, it just follows the contour of the muscle underneath. So if someone has a larger muscle, then we can see more. If there's less, then less.
Last picture, doctor.
So the last one is a guy who lost a lot of weight. He's got extra skin. So you can
Yep.
see, I took this relatively early. You can see the scar underneath the chest. That's where I removed skin. And then the nipple has been moved like a skin graft.
Oh wow.
So it had to be moved up because you don't want to preserve any of that lump underneath there. So it makes it nice and flat.
And also, are there any drugs to help treat gynecomastia? Can anybody just take a drug to
No, I wish there
help?
was, but
Yeah.
no. There's some drugs that cause it, but no good ones to get rid of it.
Ah, yes. Okay. All right. Well, thank you so much. That is a great segment there on gynecomastia. A lot of people don't know what that is. So, of course, if you're having pain or anything like that, call the doctor at 925-943-6353, or you can see the before and after pictures in more detail, drmealy.com or sanfranciscobreast.com. We'll be right back on Body Beautiful. Keep it right here.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.